Okay, Tyler, let's get your bag ready to go for the hospital, okay? So we're going to take your iPad, and we're going to take your book.
And I'm going to take my stuffed animals.
Okay, put it in the bag.
Pack some stress tools because those help you a lot.
Perfect. So now you're all packed and ready to go for the morning, okay? All right, now you go and brush your teeth and get ready for bed.
Okay.
Okay?
I'm really worried about tomorrow. I'm worried if I'm going to be in a lot of pain. There's going to be a lot of people there.
Well, the night before surgery, I wasn't as that scared because this has happened to me before. I broke my arm another time, but I was still always scared. Like, why would you be smiling when you just broke your arm and you're going into a surgery? I was disappointed. I knew it was going to be painful, and yeah, but I was terrified.
I was trying to go to sleep, and I couldn't, I was thinking of a bunch of questions that I wanted to ask, just simple questions, and I could not sleep.
I wonder how long it's going to take. Will I be asleep during the surgery? Do I have to go? Mom!
Are you okay, Tyler?
I'm really scared about tomorrow.
It's okay to be scared, Tyler. I'll be there with you. You've never done this before, and there will be a lot of people there to help you with that, okay?
I'm worried it's gonna hurt.
Well, tomorrow when we get there, Tyler, we can ask them all of these questions. But right now, what you need to do is get a good night's sleep because you have a big day tomorrow, okay?
Okay, I'll try.
Oh no, Tyler, remember, you're not supposed to have anything to eat before surgery.
Because you can't eat for amount of hours, so you're just your tummy gets when I can't eat, my tummy starts to hurt, so then I get hangry, which is angry and hangry mixed together. If you don't know what that is, that's what it is. So yeah.
So the first thing that you have to do is when you come to day surgery, you have to register. So you have to let the hospital know that you're here, and they give you a bracelet. So it's got a special number on it, it's got your name on it, and then we know why you're here and that you are in fact here.
And then they would have to sit you in the waiting room because you're obviously gonna have to wait.
Oh my goodness, waiting. That was so boring.
I just brought my phone. I could play games or talk to my mom or my friends. Just, you have to find your own way to pass time, something that'll work for you.
And once they're ready for you in day surgery, then they would come out, they'll call your name, you'll go back, and that's where really everything else gets done. So you'll get checked in by a nurse, they'll do your height, your weight, your blood pressure, all of your vitals, and make sure that you're nice and healthy to come in for surgery and see your doctor. And then after that, you'll change, you'll get into a hospital gown or hospital pajamas, and then you would get to just wait until your surgeon is actually ready for you.
Hi, Tyler. I'd like to introduce you to our child life specialist, Heather.
Hi, Tyler.
Hi.
So once you're done the preparation with the nurse, then you get the second piece of your preparation from a child life specialist.
So child life specialist is a person basically that comes in and reinsures everything.
So I brought some stuff with me so that I could show you where you're going to go and some of the equipment that the doctors are going to use and that you'll see once you go to the operating room.
Okay.
I feel like they just comfort you a lot more. And as I said, they reinsure that everything's going to be okay.
Well, what I know about a child life specialist, it's somebody who they're really nice and very helpful.
So as a child life specialist, part of my job is to go through the day with you and to make sure that you know where you're going, what you're going to see, who you're going to meet. And then I actually have a lot of different things that will help in that process. So I have pictures. We could look at some pictures and you can ask me questions about that. I have the different ways that the doctor helps you fall asleep. So we could look at those and we can talk about those. Any questions that you might have, we can go through those as well.
For me, they really helped talk to me and explain things to me that I didn't really understand, as well as make me feel comfortable around them to talk. Like, they're not the doctor where they're like, okay, you're going to get this done. Like, they're more there to support you and help you get through what you're having done. And I found it was really effective for me because other than that, I tried to act all cool and stuff, but they kind of reasoned with me and they're like, we understand this might be really scary for you, like if you do want to talk about it. And they gave you someone to talk to and it was really helpful.
And then you get a bit of time to relax, or chillax as I call it. Then sort of becomes my part where I come out and meet you before the surgery and we talk about what type of surgery you're having done. And you don't have to remember exactly what it is, but just so you have a little bit of an idea, so I know that you understand what's going to happen to you. And then if we're working on a particular side or anything like that, usually I take a little black marking pen and I'll mark the side. And then the nurse will come from the operating room and she'll check you in.
Yeah. Hi, Tyler. This is the operating room nurse, Gus.
Hey, buddy. How's it going?
This is Tyler and his mom, Lori. Hi. So Tyler's going for surgery today. Doesn't have any allergies at all. We've got a bit of a history here on him. Otherwise, quite healthy.
Awesome. Okay. Thanks, Karen. Can I take a look at your armband there for a sec? So can I get your name?
Tyler,
Okay. And your date of birth?
May 1st,
And what are you here for?
surgery.
All right. Okay. I'm going to go and check on the OR, and I'll come back and get you when we're ready for you.
Okay.
Alrighty. Buddy.
Thank you.
You're welcome.
Okay, it's time to go. If you want, you can give Mom a hug, a kiss, a high five.
You'll do good. Okay, are you okay?
Yeah.
All right, you'll do good.
All right.
Okay, we'll see
Let's
her very
go.
soon.
All right. See you
Okay.
soon, okay? Good luck.
So when your doctor's ready and you're ready for surgery, then we start to get you ready so you can walk into the operating room, you can ride on the bed, the stretcher, you'll have a bed driver, and so you can go into the operating room that way.
And so when we finally went into the OR, they asked me my name, they asked me what I was having done, just to clarify everything. They went over everything, they made sure I was okay, then they had me move on to the OR table, and then they positioned me and stuff like that, made sure I was comfortable. There's a lot of people, there's for sure a lot of people, and when you get onto the bed, they're just basically checking everything, and they have to get you prepared. They have to mark everything. For me, it was my leg, so they have to mark exactly where everything is.
There's a bunch of people, probably there's a lot of bright lights.
All you hear is beep, 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 and you can hear a lot of noise.
And then they put these leads on you to make sure your heart rate's fine during the surgery.
They put the oxygen mask on, and then I was out like a light. I was out for it felt like a blink. But when I woke up, all I hear was a bunch of beeping and stuff like that from the machines. But it was fine. And then I had a nurse at the end of my bed checking on me and doing my medication, all that. So that was good.
When you finally wake up, you're just in a bed.
And you don't feel right awake. You feel like most of your body kind of aches probably.
You kind of go in and out a little bit. You're like, oh, no, I want to sleep a little bit more. But on the other hand, the nurses are trying to wake you up to make sure you don't sleep too long. And they have to wait 15, 20 minutes to give you painkillers.
You don't remember anything really. You just will wake up.
It's a scared, relieved combo. I'm relieved that it's over, and I didn't feel anything, but I'm also scared, what happened? What did they do to me?
So they call your parents in, and a nurse or somebody brings them in, and they kind of just sit beside your bed, and they're basically all nervous, are you okay? They're asking a bunch of questions, and I bet you that you're gonna get a little bit annoyed because you probably wanted to sleep a little longer.
Hi, Tyler.
Hi.
Hi, guys.
Hi.
How are you feeling?
Good.
Good. I brought the Candyland game back because I know you didn't get a chance to finish it beforehand, so I'll leave it here just in case you want to play.
Oh, good.
So how did everything go?
It didn't hurt. Like, when I was asleep, I didn't feel anything.
That's good. Was anything different than you thought it was going to be?
No.
So it was
Yeah,
okay?
it was. I thought it was gonna hurt, but it didn't.
That's good. So you get to just hang out for right now. You can play your game for a little bit if you want.
Okay.
And then you'll see your nurse a few more times because I wanted to keep getting the numbers. And then when you feel okay, then they'll let you go home.
Okay.
Okay?
Okay, good.
All right,
awesome.
thank you. You're welcome. It was nice meeting you.
Yeah,
you did
too.
awesome.
You're happy to get out of the hospital. You just want to like go home and like play some video games, go to bed, like depending if it's late. Normally if it's late, you want to go to bed and then you want to wake up and play video games or go to school. Well, you really don't want to go to school, but like you might have to.
Sometimes you feel kind of groggy and like gross because you can't necessarily like shower right after, and if you do, you have to like put a plastic bag or do all this stuff, and it's complicated most of the time, but you have to kind of figure your way around things and do things differently than what you would have had if you didn't get the surgery. So it's basically like trial and error of what works for you after the surgery.
Stay positive, don't think negative, and just like stay as calm as you can, because if you're calm, then like hopefully nothing will go wrong, and if it does, that is okay. Things happen in life.
When you're getting surgery, you just want to make sure that you ask the questions you have. You make sure you know what's being done. I feel like me knowing what I'm having done to myself I feel more reassured that it's going to be okay, as well as you can look up what the procedure is online, clarify with yourself more, and it's just more of like a self comfort thing.
There's a lot of time to ask your questions, even before when you're there, before they're gonna give you the IV. You can ask like 3-4 questions. They'll wait for you to ask your questions and then they'll start.
And so it's always really good to ask those questions, even if you think maybe somebody will think that's a silly question. No question is ever silly, not with us. So it's always good to ask questions. And if you don't want to ask the question, you can whisper it to your parents and they can ask the question.
What me and my family did is we put a bunch of questions on a piece of paper, and when we saw the doctor, we'd asked him all the questions, and he gave us all the answers, and it was just like a really reassuring thing for my family to know that it was going to be okay.
It's like you got nothing to worry about. The doctors take care of everything, they're nice, and you get treated very well.
Surgery, people have practiced it so many times, you have to know that they are professionals, they know what they're doing. You're probably getting the best care that you could ask for.
We will take really good care of you, and you need to know that. And it doesn't matter how young you are, or how tall you are, or how big you are, or whether you're 18 or 2, you need to know that we'll take good care of you.
Don't be nervous, because it's nothing to worry about, because in the end it'll be worth it.